Excellent. I'm going to go ahead and call to order this meeting of the Dunn County Health and Human Services Board for January 26th. We welcome friends and colleagues and anybody who is watching on our constituents on our county YouTube channel. Go ahead and call the roll. All of the members are present, save Supervisor Robinson and Supervisor Breslin, who plans to join us via Zoom shortly, assuming that technology permits in Mexico. Supervisor Robinson is on. I'm sorry, Hillary, I did not see you.
That's okay. I'm still sick, so I'm joining from home.
All right. Thank you. Get well. Get well. Thanks for being here. We have a set of minutes from, gosh, October. I know it's been forever since we've met. October 27th. We have already suggested that these minutes need to be amended to correct the misspellings of Supervisor Steen. So I would like a motion to approve the October 27 minutes as amended. Supervisor Steen, is there a second? Supervisor Hagan, any additions or corrections to the October 27 minutes? If not, all in favor say aye.
Aye.
Any opposed? Minutes of October 27th are approved. Do we have any public comment? No, we don't have any public comment. All right, and weather willing, our next meeting is February 23rd. Any problems with that? We'll go ahead, and again, weather willing. All right, moving quickly, veteran service. Greg, you are up.
I'll go in order as it's posted on the website. So the first item.
Greg, turn on your mic.
2 months off from this is what you get. All right. So can everybody hear me okay? Thumbs up. Perfect. So what I'll do is I'll start off with the documents in order that are posted on the Dunn County website. The first item I'll go through is the memorandum format that just hits in some paragraph forms of some highlights. And I always approach it from local, then we hit state, federal, and then kind of discuss a little bit of the financial highlights and then the staffing of the office. So the first thing is that we were contacted, and this is a kind of a future item. We're going to committed to collaborating with the Historical Society to try to do a fall outreach event. It's just right now it's just a commitment, and typically what we've done in the past is they have some great items that you can check out from the Veterans Museum down in Madison. And so what we do is use some grant funds to pay for the shipping, and they typically will display for a month and do some educational stuff around. It gives us a good opportunity for some outreach, and that's a great organization. A lot of kind of amazed me the last time we did how much history that they have. The other item I think we shared, just a really kind of a in the emotion Facebook post, and I think some of you had seen
great.
that. Yeah, and the cautionary tale and all of that stuff is that that's an emotional, in the moment, positive Facebook post. Not all Facebook posts or social media tends to be positive. So a very that's why we wanted to be able to share, because there's nothing better than to see somebody that is open to identifying when something goes well. And I would hope as a county as a whole, because we're all partners in this, and if we can identify to the community that there's some good things going on, or somebody had a good experience, we might as well share that.
Oh, absolutely.
Can never guarantee that every time, so I don't want to identify that it's always we get to spike the football every time. But I thought that was in the moment relevant, and it really zeroes all the way down to the golden rule: just customer service. That's it. if we try to do that, at the very least, there will be good outcomes. And so that's why I was glad I received some comments back. And anytime we have opportunities, like good or bad, that will be shared.
We were really grateful that she was willing to share that. It was really lovely.
Yeah, I think it really, and that's one demographic. And I know, through other programs, there's plenty of other demographics, and some of them don't use social media that have the same emotional response when somebody gives them time, listens. So we're fortunate with that. So thanks for the feedback on that. State benefits. I keep thinking, did I report that the last time? But I wrote up a report, but we didn't have a meeting regarding Governor Evers' is surplus at the state, and I think that's well known throughout with some of the publicity. But kind of zeroing it down to how does that benefit our local veterans with that surplus? And the surplus, it's ARPA money, federal funds that they've earmarked for every county and tribal office. And it isn't to decrease tax levy, it's to increase our capacity or outreach. And it really, so we've filled out, county manager has signed the supplemental grant form that's already been submitted to receive the funds. We're eligible for $15,878. So upon execution of that, we anticipate no problems with that. It's over a 2-year period through 2024. And it's going to work nicely as long as everything continues as it has been briefed and identified, because we were just approved, thanks to the county board, to add an 8-hour-a-week position. Yeah. So this will give us an opportunity to add some hours to that, and that will meet the grant's expectation of additional capacity outreach. So that's kind of what our preliminary plans are. So it's really kind of working out nice and in line with the federal legislation, the approval of the PACT Act. So it's marrying up really nice at this point. So I'll keep you informed of that, because if upon receiving the approval of that supplement, then we'll need to do a budget adjustment and go through that process. But yeah, it really sounds like there's a lot of money they're trying to figure out what to do with. Got ideas, but I'm happy with the 15,000.
We'll take it.
I'm sure plenty of other people have ideas. So on the federal side, I've spoke each month we've been together since the approval of the PACT Act, and even leading up to that, we've already started to see some approvals of some of those newer conditions, and really how the timeline has worked. The VA has been working procedures, policies, hiring to increase their staffing, and they had put out that they were going to start approving them after the 1st. They're starting on exams, and so all that's been working nicely. It's slowing down some of the other flow of things, but sometimes that's what happens when you expand. So that is going as planned. However, our main hub in this area is the Minneapolis VA Medical Center on the Veterans Healthcare side, and we're a flyover area in the rural. They couldn't even find Wisconsin on the map, to be honest with you. So that their focus when they do outreach is within arm's reach. And so they're trying to do some outreach with PACT Act, but we'll send out like, here's a Zoom meeting. But that doesn't hit the really, in my opinion, a lot of those that are in need, because they're probably at work during the day in our area. So and that's one of the things, and I've already talked to county manager. The county has marketing person, writer on
communications person just came on board.
Yeah, and so we're going to potentially use some of that to possibly market the PACT Act if it falls in line, and then we're able to bring on. We're still in the process of bringing on our part-time person, but again, will help beginning that outreach to spread the word. There's plenty of people that are not receiving the benefits that they've earned. And so this will help, and we'll be able to help do and build upon what the VA Medical Center is trying to do with the PACT Act. On the financial side, I met with Sarah Stabenow earlier in the week to do a little bit of cleanup on a couple items, deposit some money in the within the Veterans Department, but in wrong line items and a couple things. So we cleaned a little bit of that up. That's not reflected on this current financial report. And I'll go into that because this is the first month that I'm using the report in line with my cohort. So I'm not gonna claim to be as proficient. I know the numbers, everything's okay, but
we're all getting used to it, Greg.
Okay, all right, all right, and so that'll I think be more proficient as we start working the 2023, because the one that's provided is the 2022. And so we've got we're fully staffed. The two of us still have two volunteers that help us out. And then the one intern has ended, which if everything works out, we've got the job description put in and the approval. So hopefully we're going to be able to move that intern from and hire on in a part-time capacity, which will work out for educational goal as well. So any questions about those items?
Supervisor Steen.
Yeah, I just want to mention that at the Wisconsin Counties Association meeting in December, Greg and his cohorts were down there and made a nice presentation to the WCA, and appreciated your presence. I think you guys are well received. But what was your opinion?
I would definitely agree. Our just more of a face in the background. Can't claim to do anything exciting and motivating. However, our president, Ali, is just a very well composed, good briefer, and he's from the Milwaukee area, so he's already in touch with a lot of those personalities that are there. And so I definitely agree. There's a lot of support for what we do.
Supervisor Steen.
Unless I missed my guess, you're an officer, aren't you?
Yeah.
Well, why don't you tell us that?
Yes. The second vice president of our association.
Congratulations.
Yeah. So yeah, with that definitely what pleased me is that the group was well aware of what our association is, and our goal is not a hidden goal. We definitely see the power that group, the Counties Association, has, and how we should be in line and educating them on what we do to get the support when we need that support, and vice versa when they're passionate about something that we can execute on that. So thanks. I think that was my last report that we didn't, for December, that we didn't meet on. Thank you. Yeah. So the next item will go over the small font sheet with the impact statements. And so
it does, it gets bigger.
So with what we started to track this last year with the new veterans management system, we're able to capture some of the retroactive payments that come in, and that as I described in item number 3 under the impact statement, just to throw dollars to things. Our job is more than like that money aspect. It is just getting conditions validated and supporting people, helping them get into healthcare. But we have the ability to throw like real money numbers of what came into people's accounts that live in Dunn County for retroactive payments. So we do claims or appeals, and it takes a long time to get them approved, and the VA will dump in these large amounts or send a big check. So when you look at it coming into the county, $645,000, and that there's of course more money that comes in that I'll provide a report when I do my annual report. But that's real money. That's TV money and gas money and food money and and stuff that comes in. And so I think that that's just an important thing to kind of highlight. The other,
Excuse me, Supervisor Skeen.
Yeah, Greg, I think if you would huddle up with the county manager and Doug Mill, information like this is a very positive impact to our county residents, I think, because here's a department that far and away earns itself, even though it's on the levy. And I would guess that 95% of the people would have no idea of the impact that type of money, and also the type of money that's brought in for healthcare and for the other stuff. So I think we can blow our horn a little bit on that, I think.
Yeah, the money that probably much of which gets spent locally.
Yeah, and I think some of the individuals who work with are private. They're humble, and so it isn't like they're gonna go to their neighbor like, hey, I just look what I got. That isn't typically the population. So, but it gets spent. It gets spent. So I'll make a note of that. Thank you.
Thank you, Dr. Hall. We haven't seen Supervisor Breslin yet. Okay.
I'll go back to the other impact statement, the number one, and that is just another opportunity for us to kind of highlight a partnership with behavioral health and human services. And again, you can look at somebody in the crowd and think they've got everything together. They can have every rank at the highest rank you can imagine in the military. They can have the most money in the bank, but the things that you don't know is what's going on behind the curtains. And this is an example of an individual who I had no idea until he sat down, professional, and he would have never known. And first thing he said to me is, I wrote a suicide note this morning. And so that then, kind of steers a different direction. And thankfully, where he worked at, they have very good EAP, and he's already been involved there, but you would never know it. So he's working there, but in the immediate, with the work that we do, you can't have somebody come in and disclose how difficult things are without bringing the expert into that to say, hey, let's work through this so they can feel confident, because we never want anybody to leave our building that discloses that and not have those experts do their full kind of assessment just to make sure, there's a note, there's discussion of a plan, guns are going here, contact here, counseling forward. And so you put those in place. That's that credibility again, where thankfully I'll give my support for the one-stop shop that is here, because it's literally a phone call and like somebody's there.
Yeah. Thank you, Paula.
They come right over, and it definitely helped. Then the other part is to kind of highlight the benefits specialist. Very, very difficult appeal, challenging situation, and it done a very, very good job to identify some of the conditions from trauma that affect other parts through that somatic, and it's just kind of the how things get weaved to identify really that whole person of the situation. And so that a lot of work went into that, and positive result for this individual to again get cost-free health care, and they're somewhat satisfied with the outcome, but it's a very, very challenging situation when you're dealing with the physical somatic effects of some type of trauma. Any questions about that part of my report? One piece that I failed to discuss is the bill that was passed. Well, it's made support in the House of Representatives, just to keep you informed of that. And I printed off a copy for your reference. And what that is to try to gain some support for federal funds to help increase the capacity of service offices and to have funds in areas of our country that don't have service offices. We're blessed in the state of Wisconsin with every county and every tribe having those representatives, and we see the benefit of that, and veterans would I think support that, but there's other areas of the country that doesn't exist. So this would help all of that. So I'll continue to monitor that. Then I'll scroll past that and get into the financial. Is Sarah on by chance?
We're working on improving our finances and our financial reporting at the county. So you will be seeing this kind of format going forward.
Oh,
I don't think so.
Nobody to bail me out. So
Chris is here.
So what I shared in there is that our finance director Beata kind of went over this, and I very much support the uniformed process. So then it's apples to apples when we're talking about financial reporting. So this is the first time going through this. It's got a lot more detail in it than the report I would run. And actually, Sarah did a great job kind of going over the report that I would always use within the SAP and a couple of the different nuances when you run the report. So that was really, really helpful. So within this overall, there won't be any surprises. That if I, in my assessment and looking at it, there are some increases in the salary and fringe area, which I think that without, I didn't get to expand that out to look in detail, because I believe it in other report I looked at some increase potentially in health insurance costs.
Yeah,
I think. Paul, is that something you look at? Is that increase in yours?
yeah. There's step increases and benefits increases as well. So yeah, it went up.
There, and looking at last year, so that's there's a little bit off with that, but overall, I have 3 cost centers. There's some revenue items that were placed in the incorrect spot. They're in the correct category or cost center, but they're not labeled. I like a couple donations were put in the PCS acronym, which is like a sales, it's a sales area, and that is not a donation. And Sarah helped.
So it's accurate here, right? The 2,142.
The numbers are accurate categorically. They're not labeled in the correct spot, but they show as revenue.
Yeah. On that page 3, right? That revenue public charges PPS at $11,000. Is that the one you're talking about?
Yeah, that's a state grant, which is not a public charge. So we had to clean up a little bit of that. And we're meeting again next week because we're gonna basically zero out the grant. So we're not going to be over expended in the $11,000 grant. A little bit left over in the soldiers and sailors relief. That's the other cost center. And then of course our operating cost center, which is salary fringe. And then we have a little over 5,000 that we get for paper and those items within your office and training money. So I'll have a after the report gets updated, as they're going through each one of the 16 periods, it'll reflect cleaner, as I would say. But overall, there's no concerns with the budget.
Yeah. All right.
Thank you.
It'll get easier.
I know.
Yeah.
At least I think it'll get easier.
Well, we're pretty lucky. Your budget's pretty easy.
It
I'm sorry.
Sorry, everybody.
Yeah, I apologize. My comment was that Greg's budget is pretty easy compared to a lot of budgets in the county, and so it would be kind of hard to screw this up, I think. But
but easier to see when you do.
Yeah, yeah. There you go.
Okay, there we go.
That's all I have to report. If there's any additional questions for me.
Any questions or comments? Yes, Dr. Hall.
So Greg, I know from people who are working in the VA clinics in Rice Lake and Chippewa Falls and Hayward that they're having trouble staffing in terms of providers, nurse practitioners, and physicians. They've been short and having unfilled positions for over a year and a half. And so is that something that you're seeing at all here in your office? Are you finding that veterans are not being able to get appointments, or is it working out okay for now?
So the staffing issue, it's been going on for longer than a year.
Yeah.
In those clinics, it's a pay issue, not necessarily for the nurses. It is more bringing in the medical doctors, PAs, and I think I think that might be countrywide, but it has been for a while because the VA they can't match the pay. And so that is part of some of the newer, the PACT Act 2, that is something that they're supposed to be looking at to help resolve, to be able to get doctors in. So that can be a challenge. The nurse practitioners in those clinics doing a remarkable job. And that's the comments coming directly back from the veterans that use that. So the Mission Act was approved about 2 years ago, and the Mission Act expanded community care. So if there are situations where a veteran they're not able to see them, they have the option to get a referral to use the local community, and Mayo Health System, Marshfield, that's the safety net. And that process is only began working better. And there's urgent care facilities that they can go to, Prevea here in Menominee, Mayo, and then Eau Claire, Marshfield, Prevea. So the care is there. Process can be a little challenging, and wait times are in line with, I think, everybody else.
Great, thank you.
Well,
Any other questions or concerns for Greg? If not, thank you. Excellent report as always. KT and Jeff, without exception, I'm wondering if I can move the Human Services report up in deference to the fact that Sarah Ollinger is here with us. Any objection from anyone? KT or Jeff, you willing to hang in? All right, I'm going to move up the Human Services report. Paula, you're on.
Thank you for doing that so that Sarah's able to leave if
Absolutely.
she wants to.
Sarah can go home.
Appreciate that. So, yeah, you're right. Sarah's here tonight to talk about the first episode psychosis program that Dunn County leads for the consortium. And so we'll be hearing her presentation in just a moment. I did want to highlight, though, a couple things within my report before jumping into the presentation. I wanted to remind individuals that we are having a housing study forum here on January 31st at 4:30. And this is really began with Health Done Right as part of their housing work group or committee action team. Thank you for that language. As part of that action team to be able to really research the housing issues within Dunn County and then being able to identify some steps moving forward. And so the grant that we received from the Community Development Block Grant helped pay for the study, the research that was done, and some of that information will be presented at this meeting along with some next steps of, what do we need to do now that we have this information. So it is important to be able to be there to hear that. If you're able to, it would be much appreciated. Dr. Hall?
Next Tuesday.
So there's also some sort of housing forum next Monday at 6 p.m. And so I'm confused.
Yes, the county entered into an agreement with West Central Wisconsin Regional Planning to do a county-wide study, and that's the CDBG grant and monies that came from the Community Foundation of Dunn County. However, the city of Menominee and the village of Boyceville have each entered into a separate agreement with regional planning to do their own studies. So the Monday night meeting is the data that were gathered for the city of Menominee, the county-wide study, which of course includes the city of Menominee and all of the townships, will be Tuesday night, and Wednesday night it goes to Boyceville. So 3 separate, but obviously closely linked studies.
Yep. Great question, though. Thank you.
Yeah, really.
So just a reminder for that, if you're able to attend and participate in that. And then I did want to just highlight again in my report, the Consolidated Appropriations Act of 2023 that impacts the food share and Medicaid eligibility for consumers. And so we call this the unwinding of the pandemic, the emergency pandemic act that really looked at supporting individuals through the pandemic. And at that time that this was put into place, a lot of our normal testing or rules to make sure that people are eligible for the program were set aside to help, protect them at that time. Now, with this unwinding, those things are now getting back into place. So I outlined some of them for you, but Jessica, who is the manager of that unit, will be here next month to share her report, and you can ask questions, and, we can kind of go from there. Certainly, we don't know the impact that this will have, but we're guessing the impact that it will have on individuals and families. And so we'll keep a close eye on that as it continues, but I wanted to make sure you were aware that this is happening, and there's some significant concerns about services that people have been receiving, not only food, medical insurance, but it impacting some of their programming, like for example, children with disabilities in that program, if they no longer are eligible, they may not be eligible for that program or CCS or any of the other things that not only our department offers, but other medical programming as well. So something to keep an eye on.
That they've been accustomed to for almost 3 years.
Mm-hmm. Yes, and Dr. Hall.
So I've appreciated seeing on social media a lot of the notices like, hey, this change is coming. And I apologize, I'm not the person in my household that does the grocery shopping. Is there public messaging also, like, are the grocery stores involved in letting people know, like at registers or anything?
I have not seen that or heard that. So, and again, my husband does all the shopping too. So I get out of that. So I haven't seen that. I'm like the luckiest lady in the world, but
I wonder if it would be.
That's a good idea.
Right.
Useful. And I don't know that we have relationships with them, but it might forestall some really emotional, unhappy encounters.
Stepping Stones, obviously aware of this, does have a relationship with all of the grocery stores because they do regular food rescue. So that that's a possibility for a partnership about.
Sure. And I can check with
Madam Chair, this is Barbara Fagan. May I?
Absolutely, Ms. Fagan.
I I'm on the board for Stepping Stones, and we just had a meeting today, and there's a big plan for Stepping Stones to use their Facebook and social media and work, do what Dr. Hall is to some extent what is suggested, and I can, if it's at all appropriate to the committee, not to take away the committee's responsibility or prerogative, but I can pass that on to Mr. Gallagher as well.
Yeah, absolutely. Absolutely. Thank you, Ms. Fagan. I appreciate that.
Yeah, thank you.
Mm-hmm.
Yeah, because not everybody's on Facebook.
Right. And it is also being
progress.
We also are notifying consumers as they're calling into this, the call center and all of that messaging. We're trying really hard to get that out there, but certainly people can be missed, and it will be shocking. For that. And the only other thing I wanted to mention that was not in the report is I've been reporting that the children and families managers and myself have been going around to the schools in the county, introducing ourselves and meeting with certain personnel there. And so we've met with Boyceville, Colfax, and this last week we met with Elk Mound. It was just really exciting to meet with all 3 of the schools. We heard a lot of feedback of really great stuff going on. We heard some things that could maybe be tweaked and done better, and we've come up with different plans to be able to do that in collaboration And all of them said, yeah, come back. Let's do this twice a year. Let's, keep connecting and collaborating together. And so I'm really excited about that. And so Menominee will be next. We'll do that, but slowly making our way around and having those connections. So that's been great. With that said, I'm going to pass the reign over to Sarah and have her introduce her program. As you're maybe aware, each month we're going to have a different manager come in and talk about the programming and every specific program. And so Sarah offered to go first. I want to say that
yay, to be kind. Will be nice.
I want to say that Sarah, I asked, I was on the conference planning committee of WICSA, which is our County Human Service Association, and I offered Sarah at our last conference, and Sarah and the team and a consumer and the consumer's family came, and the presentation with the consumer and the family and the providers there was just so powerful. We don't have that tonight for you to see that powerful interaction, but I am just amazed. It just warms my heart to see the progress, what the consumers are saying and the change that's happening with these young individuals. So I'm very proud to introduce you to Sarah in the Choices program.
Welcome. Thank you, Sarah. Sarah, it's all yours.
All right. Let's pass around. Just wanted to bring a program brochure. And we do market a bit, so we do have hand sanitizer for those who want those.
Liquor bottles.
So the program started during the pandemic, so hand sanitizers were a key item. Sure. But again, I'm Sarah Olinger. I'm one of the 3 behavioral health managers, and I have the great pleasure of working on a piloted program where Dunn leads and serves Dunn County and then 8 other counties. And we are one of 3 programs in the state of Wisconsin doing this type of work. So thank you for the opportunity to be here. So just wanted to come to be, and it really started with these 9 counties. It really started with that idea that we are in a wonderful area to live, but maybe lower in resource, particularly when it comes to behavioral health and different specialty areas. And really, Paula was the director of PEPN at that time. Lots of directors got together and said, what can we do? Should we apply for this application? And they really had the passion. I believe they had to pull it together within a couple of months. And it was a sizable report, and they decided to do it. And part of it is because I just put up the consortium up there because I'd already developed relationships between all 9 counties to be able to throw data together, to be able to just have those relationships to get grant writing done, and to really want to serve counties that would not typically receive this service.
Paula, Pat Breslin has joined us.
So I think another question that often comes up is how common would this be in this rural area of 9 counties? And the number that has been studied is 53 youth and young adults will come to have first experiences of psychosis. That could be hallucinations, seeing things, hearing things, could be paranoia, could be a lot of disorganized thinking. But that number sticks with me because 53 in a year is quite a large number. And population-wise, the region that we're speaking of is right around 250,000 per population. The other thing is that other states and the federal government really supports early intervention with these youth that are experiencing these things. I think we all know of schizophrenia, schizoaffective disorder, bipolar disorder, kind of all of these labels that come with some difficult life experiences. And so these are young individuals serving 15 to 25 is what the program is set up to serve. So our team is in there early, hoping to, we've had some participants as early as 2 weeks after an experience, but the hope is really to catch them early, to give them and their families and their supports skills to really move through these experiences, avoid hospitalization whenever possible, because that's safe in hospitals, but it's believed that an inpatient stay doesn't necessarily teach them skills, teach their family education about their circumstances. It's a holding ground. It's not a place to necessarily get a lot of good treatment. The last kind of arrow up there is really about the quality of life. You know, that a lot of individuals that suffer from severe and persistent mental illness need quite a bit of human service support, maybe need great support because they need a lot to have meaningful activities during the day, which could be school, work, college, healthy relationships. And the program is really stems around that. How can we better each day as they're experiencing it? And I would say I was with a program participant, that actually was brave enough to go to a conference and to speak and have his life kind of very much on blast and out there. But I talked to him this morning, and what he said to me, I said, how did you sleep? And, oh, I'm not having terrible nightmares anymore. Fantastic. Because, you know, a year ago, he was someone that was trying to jump out of a window. I mean, he was needing police contact. He was needing a lot of sedation. He was needing to be away because he was having violent kind of command hallucinations is what they're called. And so not only was he hearing in his head to hurt people, but to hurt himself. And that's what created the whole jumping out of the window experience that he had more than one time. So happy around to nightmares. Very happy to bring him to school this morning. Very happy. He actually is currently staying. He just turned 18. He's staying at a Pure Run respite in town called the Monarch House. And it's free. It's not punitive. It's not jail. It's not a hospital setting. It's a community resource. And I think that's the spirit of the program, just to get them to have the confidence, the skill to really just use the resources just like anyone else would. So it's great in a couple of months. But okay, got into the story. That's hard not to do. You know, just going back, this has been a process. Dunn County, really, I give Chris Corpola a lot of credit. She had the vision on and sort of represent and lead as a county, and just wanted to throw some numbers. Some numbers up there. So in our small kind of geographical region, we've already served, I went off of the 2.5-year mark. We were at 57 currently. 7 referring counties. So again, this is a regional program, but those are the counties that have referred. We currently serve all of those right now as well. So it's a lot of passion that goes into the Dunn County employees to be traveling up to Sorona, traveling up to Frederick, going to Siren, going to Plum City. You know, it takes, I give them tremendous credit, and it really comes from all that. But currently we're serving still right around that 20 mark. We just actually received 3 referrals in the last 2 weeks from, they're all actually from Dunn County, and they're all middle schoolers. So they're right around that 14, 15, having, in my opinion, too many hospital stays. They're having too many missed days at school. So we're really trying to, I'm so happy that you're reaching out to the schools, because we're trying to do the same, and we're happy to see those referrals, 2 from Menominee and 1 from Elk Mound.
Trish says something about age 15, but I noticed on here it's 12. Do you go down lower? Because I know the schools are seeing them younger and younger.
As are we, yes. Through the initial grant writing, we were sort of guided to put the 15 to 25, Department of Human Services approval, to be serving as young as we wish to serve, quite honestly. We have served an 11-year-old up in the Frederick area. Just mentioned some 14-year-olds. They are really being quite flexible because our team comes in with a lot of assessment. Perhaps it could be some beginnings of mental health and severe mental health issues. Perhaps it's trauma. Perhaps it's family change going on. Perhaps it's some drug use. Just our team is able to answer what is off in schools in that case. Just figure out, gosh, what is really going on for that youth and for that family. We've had a lot of, I would say, good partnership in kind of figuring out children with autism. That's a combination, and we're finding it's more of a combination than one or the other. And I think that will be interesting to sort of watch and see. You know, and something to bring up here too, the CCS program, the Comprehensive Community Services Program, I also lead that program. We're expanding that a lot, and partly because of just community need, and partly because Paula has asked us, and Chris has asked us to get better about, for those Medicaid funded types of services, to get CCS involved, to get waiver involved. That was with children with long-term care needs, just to marry those programs together where we're able to do that. And so happy to report that our staff has been working hard, and about 8 of the 20 are connected to Medicaid funding. Right now, we have the privilege of having 3 full grants. So we received, I think it was a little over 400,000 that mainly goes towards staff. And, you know, we're getting, I think we made back about 80,000. Well, not this year. We made 80,000 last year end those same providers. Certainly the state hopes we get fully sustainable. And so we're working as hard as we can about that. There's some difficulty in getting all community members into CCS because of income eligibility. Hopefully we'll reach what we can sustain, and hopefully we can still continue to get some grant funding. So we are in the start of year 4 of the 5-year grant. Milwaukee and Madison both received another 5 years, which I haven't, of course, there's no promising, but I have been asked to really strongly consider reapplying for the 5-year grant and kind of defining what kind of need we may have. Wanted to put up there, I mean, he's cute, but I think it's also in behavioral health and mental health around, gosh, leaning into asking a lot of questions, even though they might be saying demons are outside, or I'm supposed to really harm someone, or I'm paranoid by the traffic. Really trying to begin and ask questions versus just like, oh my goodness, you're unsafe in the community. We need to get the police here. We need to get Northwest Connections here. We need to assess. And instead we're taking it all serious, but we're also really trying to just get these kids, really trying to understand meaning behind their experiences. So we did some training. We've had the great fortune of having really excellent training. There's 2 PhDs that came over from England. Actually, we met this fall. How to really, in an organized fashion, in a sensitive fashion, really begin to explore their experiences. And I just put some of them up here, but setting limits with the voices, you know, scheduling even a meeting with the voices, like not right now, organizing the voices. A lot of the instruction is to how many voices do you have? What time of day do you have them? Do they have an identity for you? What is that? What does the sound, what does it sound like? Where does it come from in your body? Because sometimes it might be in one ear. Sometimes, you know, it's visual, etc. Just to really lean into it versus just kind of saying you're really ill, you know, you're really sick. And not that they don't have sort of disturbance in their life, a lot of distress, but just trying to really validate their experiences. One of the things that we've been doing is having hearing voices groups. which is newer in our community. We've had about 20 attend. It's been going strong, about 13 months now. 20 have participated in those, and it's all about, gosh, you're not alone in this. Other people experience this, and you know, you can come here and share what you want. There's just referrals because just each may have someone in your, you know, your neighborhood, your family members, whoever it might be, that is just a quick referral process. I love this quote. I'm sure you've seen it before. And get to go home, it sounds like. So, yes. But I love this, and it's so fitting. Here are the pictures of the hard-working team that we have. We have 12. Kara is kind of Choice's team, and down, that's Kara. She is our psychiatric nurse. On the edges, we have the Dunn County people. We have 2 therapists, 1 education and employment specialist, 1 social worker, and we're lucky to have 6 peer specialists involved that come with lived experience, and they're able to really act as, I've been through this, I've been through hard things, and they just model that resiliency every day. These feel like the credits because that's kind of the end. There are all their names, but I believe they're in the PowerPoint and then just resources. But I do thank you for your time. I am super excited about just being able to serve in this way and to get the word around. So thank you.
Are there any questions or comments for Sarah, Ms. Barker?
Sarah, you shared those brochures. Yes. I was going to ask you for some if you hadn't, because I work in both Dunn County and I work in Pierce County. So
sure. Yes, we spent or I spent in the beginning traveling around doing marketing. I spent a lot of my time on the development of this program, and part of that was marketing. We have a website presence. But schools are a big referral source, and so we definitely have brochures.
Yes, definitely.
Yes, thank you very much, Sarah. I've had some interaction with Sarah for a number of years, and every job that she's given or every task that she takes on, she always does a great job, and I'd just like to thank her for her efforts.
Absolutely. Yeah, a great program like Elder is a huge asset to our Human Services Department, and we're grateful for this presentation and just to have you with us. Thank you, Sarah.
Thank you.
And you get to go home.
I just like to say, just wanted to reemphasize that the current grant is a bit over $400,000. It renews. Sarah gets to redetermine a budget of what's needed in order to sustain annually. And at this point in time, the grant totally funds the program. There are monies earmarked on the federal level for mental health and substance abuse block grant money, and a certain portion of that needs to be spent inside. So the state is hungry for counties to be willing to provide this program because it is very intensive service delivery piece. And so I just wanted people to know that we essentially are doing a taxpayer dollar, obviously, because it's not free, but we do not have counties that be involved in the program.
Thank you, Chris, for that update. And welcome, by the way, Supervisor Breslin. We're glad to have you. I changed the issue on the agenda. So, Ms. Wicker, yes.
This is financial report. So in front of you is a should be of the county financial report. So the same obviously because we had especially back in the county in 2022. So we had questions in there was a cash one of the spreadsheet documentation in going forward. And really the message that is application of SPM. Some is not everything to all these SLGs are exported into SPM with SPM information. You have to go in and capture the data from these spreadsheets anytime you are and that appears that in this whole constant of the also important which is one thing from the top of your website for 1,000 that of your that's 2016 this a little more so you'll see some more and that's time it's something like also for January so we have one framework so we should be report and questions regarding what is more than I'm not sure if you mentioned to that is we have put some so versus some this week is training from able to and also some of the should be meeting with us next month we'll look at that as well so testing for years and actually it's not so it is it's obviously I know there's a lot of money so yeah I'll do that here and we'll put that
Thank you, report. All right, health information. It is now in your court, Katie and Jeff.
And additionally, I'm with the reports from the state and from the Western Task Force will do this. We are seeing increases in the so and it's following another next week. So I want you guys it's also in the report that was sent out today. Also, information about so see the even if they're working in their short release and see if you can let's go over to the that person for which is very well and our and so just actually have questions when you see their questions about what I'm going to get back into and actually Jeff on fee section.
Any questions for Casey before we move? Go ahead, Gia, please.
Wonderful. So Jeff did a basic research used in the packaging some background on what we're asking and why. So I think it's so we have a little more response from our community. Other things that we don't have a little program behind it. Because it's response on and so there's a local control that having a form of this now. That's using the training of resources and using for fees with our facilities. So you'll see that our program is largely cost of our program is largely with staff time. So that's 2.5 in writing our program and that in that we have low cost that we're not currently. So we got 2 things associated with have our cost and our total cost. So what have is our cost and our shortfall in our cost to equipment and to also increase costs with the increase. I also want to share with you the cost is required by regulation. Regulatory requirements are not forced to be cost to so any issues in we have sufficient time we have enough to make sure that allow us to unfortunately that's our cost and to have the cost reduce time and the on-site analysis and we do additional exits so I'm thinking back or we like which is very cost effective to these businesses. So we need to use businesses. We'll see that together that if you can based on construction and businesses that would be $1,000 revenue. So I'm seeing
real nice that the substance on the right track from the get-go. It's a lot harder to get this is if it complies for
and that's very interesting.
Yeah, it depends on the facility, what type of that's talking about, but it's a lot of blueprints and plumbing and other kind of things requires. So like putting the lines and get back with the figure out and have to make those kinds of codes. Fees are appropriate to the last any questions, concerns. It's really maybe the university also did that actually counties on the area that we heard of. Both areas have to be nurses are more than so that's more depending on the county. I know exactly the percentage covered by the counties, but it's pretty common to have that 70% is that.
Thank you for that. Thank you for the different options. I really actually going to really kind of helpful and be able to be informed. So I just thank you for that. My question comes from seeing that we're peers and seeing what you have to understand. And so the question I have is different types of licensing is food, for example. And the first question, and then the question is, retail food not serving meals complex. Is that a grocery store? Okay. So that see that the company is on sales, so which size of the overall business, and never kind of peg it to something accessible afford. And so my question is, so the different levels of fees they so the question is, well, when you look at the differential fees of different types of licenses are appropriate as they exist, and yes, like for maybe commercial extent. But the question in case of very large businesses, such as perhaps some of our grocery stores, does it make sense to look at paying the size of the fee to smaller such fee margins from both sides, proportionally fee increase compared to larger businesses perhaps a little bit very. So that's my question. The different I'm trying to see if some of these categories couldn't afford a higher fee because they're not supported for even the smaller guys. That's it. I think first we want to use more time tracking and see how much time to spend in each of these facilities. I think we're going to be on average and like if it's straight off the board that way. So obviously a smaller business, a lot of things can be a higher complexity could be, but you're less negative as much as it can be house. So I think we want to do a little more time tracking and see where is the in these facilities that the access for that we're just starting to yeah, and thank you for that. You're working on the time tracking of stuff that's involved in this work. So it's not just access. That would ever lie to me without that ever. Well, they are, and very something that both at a national and a state level to say, if you've got this kind of a restaurant or this kind of grocery store, it costs amount of time to do something that's for you. When it comes to sales, we have that harder. To talk a little bit about time tracking, supervisor house, yeah. So when I started, we had 100% in health is awkward of 2022. So right, just because that our proposed expenses are within our business strategy. We have and is about the reasons we're asking for. So now we're not counting your for we have business versus kind of normal time needed to get a program. Any other questions? I asked the action item discussion. We don't have a full resolution, but I asked if the board is willing, I go my proof best recommendations to move for the fees by 50% and a plan review for no business new businesses beyond July and state application move towards efforts of covering less than 100 costs. If we are ready to move forward, now we entertain a motion to approve the department's recommendations. Are we okay on this? Just make sure that the dollars that are used specifically for co-op and other fees are used for workshops. And it's like, $100 and that was unexpected. That's kind of admin and staff increase over the previous budget amount. Any questions on what I saw in the packet? But in this is between what's budget and our actuals and bizarre. And so just trying to understand that it looks like some of that is much lower for an response. So you can just take an additional which I'll use to I think we're different than what we had to helpful. Yeah, absolutely. So great points. So when we first started, we were in the response to our planning. Also did we know how much money we trade these big multi-year grants, and actually differences in these and maybe and it was also very hard into year. With our reproductive health again, we have lost really especially we're responding to COVID things that were really big progress to really contracting calls for COVID. And that's important to have so we have more specifically reproductive health and also programming. Let's see, I think those were the significant changes. But let's do our actuals work. Yeah, those are three. Thank you. Any questions? So nothing monthly and but every monthly. I understand. I obviously we can get you guys what you care to see. I understand that you guys will see the first page of the report 107 monthly, and you'll see all for the health departments, all 7 pages quarterly. If you'd like to see the entire thing, you can plan this veterans or health department. I think where that's going to become available is in those March departments. So let's know what you want to see. Yes, sir. So just for clarity, on team service, so the last 2 columns are different on team services and health department versus veterans services. Differently. Yeah, the last 2 columns are usually total and year-end projected. For the other 2. Oh, let's see how right they printed. I think I put them analog. Maybe it's my own fault. I think they are the same. Oh, it's from the printing. All right. Well, now isn't that embarrassing? Okay, I'm gonna not embarrassing. Printers are printers. It's something that our CFO had put together for all of us, and it is a really nice macro where just send it to a PDF. And so I was really confounded if there was a difference in formatting. Okay. Anything else? All right, we have one last item to take care of, and that is the DHS vouchers for November and December. It just seems like it's been months since we looked at this. 248, 491, 27. I need a motion to note review. First, let me ask if there are any questions. I need a motion to note review of the November and December DHS. Yes, so my question is, if we're not getting all of the stuff every month, we will still get this every month, so we'll still review these every month. Okay, we'll still review these every month. Thank you. All right. All in favor? Anything else? Any announcements? I'll remind you of the housing forum in this room next Tuesday. Lots of fascinating data of the need for several thousand additional housing units in the county. So it will be interesting, and we've asked
regional planning to bring us recommendations about things that we can do. So yes, we have no control over. So hopefully it will be of interest and helpful. Anything else? We are adjourned. Thank you all very much. Thank you, Supervisor Breslin, for joining us from